Hey everyone, this is an unplanned video that I just wanted to quickly go through because a couple people asked me about ear piercing, and so I just kind of wanted to show you what I do. It's not right for everybody, but it works really well for me. And so I'm just going to go through. I literally did not prepare for this at all, except I grabbed our little ear piercing tray thing. And so ear piercing, what we do is we use this Blomdahl, I don't know how it's pronounced, gun, and basically, this is going to be loud. That's what it does. And it works great for piercing ears. I do 3 months and up, basically, once they've had their first round of vaccines, for no good reason because there's no like metal or anything. But that's just like a fine time to start doing it. I actually have 2 guns so that when they are 3, 4, 5, 7, 10, and a little bit nervous, instead of doing one and then having to talk them into doing the other one, you can just do both at the same time, and usually they're lined up a little bit better than that. So in terms of like going through and actually doing the ear piercing, you get all sorts of stuff. So these are pre-piercing swabs, and basically all it is isopropyl alcohol. So when you buy the little kits, they come with these, but then we just use regular alcohol wipes. Wipe off both ears at the same time for a good 20 seconds. You can use that time to kind of just build rapport and make them feel comfortable with you and what you're going to do so that they're not overly worried or anything like that. And then you obviously would put gloves on. I guess I'll do it just for the sake of completeness. Obviously, it's not a sterile procedure, but parents come to you because you are not somebody at the mall that does it, and you advertise that it's medical grade ear piercing and it's sterile because they are sterile, and so you want to kind of fit the bill with some gloves. So then we stock these are the little ear piercing cassettes that you use. You can get a billion different ones. We only stock pink and diamond because I don't want people to spend 20 minutes trying to decide and going back and forth on do they want seashells or unicorns or anything. Nobody complains. They've already signed up for the ear piercing by the time that they've come, so they can either have pink or they can have diamond. Historically, trend-wise, pink is almost exclusively like 2 to 5-year-olds, and then everybody after that wants diamond. Parents usually want diamond if their baby is young enough to not have an opinion too, because it matches better and everything like that. So all you do with these little guns is you cock it back like that, and then you open the cassette thing, and I'm going to actually waste one of these just to show y'all. It's sterile, like it's sterilely individually wrapped. I'm going to have to like turn my thing down just a bit. There you can see the crap on my floor. And check this out. So I just moved into this practice. I just opened a new pediatric DPC practice, and I haven't put my bookshelves up on the wall yet. So there's all my books. So what you're going to do is you're going to basically just load it right in, just like so. I'm going to do it from this angle, like that. And then overhead, it's just like that. Easy peasy. And then what you do, so then it's got this like plastic safety thing on it, so you can't pull the trigger. Whew, I'm glad that worked. You're going to take that off. Before you actually pierce their ears, you're going to, I'm just going to use this as an example, as if I'm going to pierce an ear, since I don't have an ear that I want to pierce at this very moment. You've got these little surgical markers. And what you're going to do is just mark on the child's ear where you're going to do the piercing. And I just do a little mark on both sides. I have the parent that's with them confirm that it looks like it's in a good spot. If it doesn't work, you can just use rubbing alcohol and move it to the correct spot. But I always mark it because then you know exactly where you're going to go. And then what you do is all you do, I wish I could zoom in well enough to line this up, but is you line up the end of the thing, the end of this gun. I'm just trying to turn it so you can actually see exactly where the ear piercing is going to go in. With the end of this, you do a little count, and then what you're going to do is you're going to push this trigger, which it's on both sides, to actually fire the piercing. What's going to happen then is the earring is on this side, the back is on this side, and they're just going to come together. And so I'm just going to show you what that actually looks like in practice to pierce an earring. You find where it is, you squeeze it, you say, okay, I'm going to count to 3, and then you say, you know, what are you getting for your birthday this year? What's your favorite color? Or something like that to distract them. You do 1, 2, 3, and I always fire right before I say 3 so that they don't jerk their head around when they, you know, get to 3. And I hold for just a little bit, like I fired by pressing this down, and then I just hold for a little bit so that it sets well, and the back doesn't come off. And then what you've got, you just slide down and you've got a pierced earring right on target. That's how it works. It's super easy. It comes with these Aftercare wipes that then I give them 2 packets of those. I say, keep using, wipe them in the morning, wipe them at night until you run out of wipes. You should try and leave them in between 4 and 6 weeks if possible. If one of them falls out, if you lose it, if you're at grandma's and you can't find it and it comes out, just put in any old earring to keep the hole open. You don't need to twirl them. You can do swimming, you can do baths, you can do all the usual stuff that you would do. If one of them comes out and you don't notice and the hole closes back up, if you can't get one back in, just come back in. I've literally, it maybe happens once per year. I'll just go out to their car and load it up and pop it again. It's that quick and easy, and I don't charge them for that because it's easy and doesn't cost much, and it's just a good way to take care of people. That's how ear piercing works. Super easy. It's fun. Parents like it. The best trick to do is just practice. You can just practice firing at the same time so that you can do one of these, and remember, you squeeze this all the way in and then you pull the trigger. If you try and pull the trigger when you haven't squeezed it all the way in, it doesn't work. So you pull it in and then exact same time. That's it.